Welcome to Take 3 and Call Me in the Morning, a podcast where three doctors from three different disciplines cut through the noise and bring nuance and practical insight to conversations about health that actually matter in our day-to-day lives. I'm Vahid, a physician, and I'm joined by Pega, a doctor of clinical psychology, and Adam, a doctor of physical therapy. We bring our perspectives together to connect the dots and tackle the questions, trends, and everyday issues that can leave people unsure of what to believe or what to do next. No gimmicks, no fads, just real conversations grounded in evidence, experience, and a dose of common sense. In today's episode, we talk about the challenges of maintaining health in an unhealthy workplace environment. We discuss various aspects of workplace health, including physical, psychological, social, and structural factors that can contribute to an unhealthy work culture. We hope you enjoy. All right, welcome back. Today we're going to talk about how to be healthy in an unhealthy workplace. Something I think both of us here are familiar with, but probably everybody listening that works. Have you ever had lunch at your desk? Maybe you do that every day. Do you sit a lot? I don't know. What do you think, Adam?
Are you asking me, or are we asking the audience?
I'm
I'm terrible. I schedule
imaginary
patients straight through. We are our own worst patients, but yeah, pretty unhealthy. I think some of the topics that you were discussing are kind of interesting. If you wouldn't mind just reading off the titles of those topics that you told me, and then we can kind of break down from there. I can give my experiences, you can give yours, we can give some action points and some take homes.
So I was gonna go down by breaking it down into how, like, the types of unhealthy, right? So, but before that, can you think of something in your own sort of memory banks of, or even maybe recent memory of, what you consider to be unhealthy in your own workplace now or before, or at any point?
No.
Your workplace is completely healthy and always has been?
Yes.
Prior to having your own practice?
I'm giving you nothing, sir.
Yes.
I'll give you the anecdote that I give a lot of patients in terms of how I view it as a credit debit type of situation, right? A cost situation. So the tissue cost, one might call it. But imagine me going through undergrad and physical therapy school, 7 years of basically hunching over, taking notes, reading a textbook, whatever, pretty poor posture, and then immediately going into standing all day and slightly looking down at patients for the most part. I don't know, probably 80% of the time.
You look down on your patients?
Yes, 100%. Okay. Do you not? Isn't that what we're supposed to do? I'm a doctor. I have a doctorate. The world is beneath me. And I'm a physical therapist. We're one of the worsts. Yeah.
Okay.
So instant upper back pain, pretty severe upper back pain, like thoracic, my first couple months, even maybe first 6 months of practicing. And then I was, trying to do all my newbie exams, like, oh, maybe it's Scheuermann's disease or a rib costochondritis. And then I was like, why don't you just start working out more and not be an idiot? So I started deadlifting, and that almost immediately, relative to physiology terms, like within a couple weeks, completely took my pain away. And so reflecting on that, okay, what's happening there? Well, I'm exposing my posterior chain, specifically all the erector spinae muscles.
Can you just quickly elaborate on what is the posterior chain for those that may not know?
Back around to it, because you missed last time with Pega.
Oh, you talked about the posterior chain?
We talked about my erector spinae group, yes.
All right, I'll leave that one alone. Okay.
So it's basically, consider it all the muscles on your backside, from your heels all the way up to the back of your head. It's basically, think of like a grouping that just keep you upright or erect, not slumping and falling forward. That's what we consider posterior chain. Movements would be like a deadlift that works a lot of the posterior chain, or an RDL or hyperextension, something like that. Looking forward and hunching over, my muscles were not strong enough to tolerate what is essentially an isometric load. It's some constant muscle tension in the same range. So the muscle's not lengthening or shortening, it's just tensioned. That's not super ideal for muscle metabolism. And if your tissues are not prepared to tolerate that, then you're going to have typically some pain or some sort of symptomology. So I got them stronger. I just started deadlifting and it went completely away. So I've always thought about it more like that. Okay, whatever you're doing, there is no perfect posture. We always, our cute little anecdote is the best posture is the next posture, right? I.e., keep moving. Think about what you do in your line of work, understand the tissues that are being stressed and shortened and stretched, and then make sure you're doing something to recover that workload, right? Pay the tax man, as it were. Does that make sense?
Yeah. Yeah. So in your instance of kind of summarizing that in a nutshell, you were doing a lot of being hunched over. You called it isometric load. Is that, am I saying it right? Okay.
Yep.
And then the pain started when you switched positions, I guess. So
the pain was there all the time.
Whole time. Okay.
It was due to the metabolic muscle load of being isometrically hunched over for long periods of time.
Even when you were standing, you're kind of looking down. So, all right. Yeah. And in my case, if I'm to give you a little example, I think I'm probably more in the realms of nutrition. For me was I would forget, especially in residency. So that's the memory I have that was the strongest in relation to like an unhealthy work environment, just not conducive to it. Obviously in medical residency, I'm assuming in your training is kind of similar. If I didn't have medical students that actually cared, I would not eat on some of my shifts because I would just either didn't have the time or wouldn't remember because of how stressed I was. And so they'd bring me stuff to wherever I was working, and I'd kind of snack on whatever they brought me. Access to healthy food was very, very limited in the hospital. Unfortunately, I think it's still the case for many hospitals and many training programs. Hopefully that's changing. Being sedentary for some of these shifts. So yeah, there's a big combination, obviously high stress, all these things that made that particular workplace unhealthy. Fast forward to now, no longer in training, not a whole lot different, right? Still high stress environment. You're getting double, triple booked in these high volume practices. And if you manage to squeeze any minutes out of your 1 hour lunch hour, because usually you're either bleeding into it from before, because they've overbooked you and you're still dealing with patient cases, or you're having to handle telephone calls. If you're not setting boundaries around those things, and that happens a lot in these high volume practices, then basically you're sitting maybe 10 minutes at a desk eating some kind of fast food type thing. So again, yeah, that would be my some of my experiences there. So let's go right into defining what we mean by an unhealthy workplace, right? Because you and I have both described a couple of different scenarios here. I'm going to go to my list here. So we're going to break it down into 4 categories: physically unhealthy. This is all with relation to your workplace. Psychologically unhealthy, socially unhealthy, and structurally unhealthy. So physically unhealthy, that means your physical space, right? Maybe your job requires a lot of sitting. You're spending a lot of hours sitting at a desk. Maybe the lighting where you are is horrible. You don't get any daylight in there. What else? The food environment around you, so that just the physical space around you does not have those healthy food options. Psychologically unhealthy, again, going back to some of my examples here, the personal examples, high stress environment. If you are in any kind of fear-based leadership, there's lack of support around you, not a lot of leeway in terms of mental health days or support in terms of taking a break. So that would be a psychologically unhealthy environment. Socially unhealthy is if you are in a workplace where there's a lot of gossip or there's a lack of camaraderie, that type of thing. And structurally, that would be, let's say, the most common one, the one that I can definitely say I've got a lot of cases of in the past, is folks that are doing shift work. In a lot of fields, there's a lot of understaffing. Again, they don't get enough time off. And so I would say also structurally could be the culture of communication in that workplace, right? So it could just be that you're getting emails at all hours of the day, even when you're off the clock. And so again, it has to do with setting boundaries. So those would be the 4 categories if we're defining an
So
unhealthy
structurally, it's
workplace.
more like workflow type of stuff.
Exactly.
Okay.
Exactly. And I think probably anybody listening is can relate to at least one of those categories, but most likely 2 or 3 or even all 4, because I know you and I can probably relate to all 4 at some point in our careers. Um, it is nice having our own practices now, but still, we, like you said, we are still,
Bosses are dicks, though.
yeah, we can still
Lots
be
of
pretty hard on
sexual
ourselves. Yeah.
harassment in my workplace,
Yeah.
specifically. Yeah.
I guess there's a lot of mirrors where you are. So, so moving along here, trying to keep this clean, man. All right. So let's talk about how it impacts our health. All right. Why don't you tell me, Adam? Let's go with the physically unhealthy, right? Because I think that's the most common. Sitting for long periods, what that does to the body. Like, could you elaborate or share a little bit of what you think about that in the workplace?
How deep do you want me to go, Vahid?
I just break it down into what's the impact. Like, what does that mean for someone that's sitting a lot during the day, moving very little?
It's just kind of I think a better way to think about it is understanding the tissue costs. So for example, sitting, right? There's you're compressing generally the anterior portions of the spinal discs a little bit more. You're shortening a lot of the anterior muscles like the hip flexor, for example. You're lengthening things like the glutes. That specifically can create a scenario that we refer to as gluteal insufficiency. Basically, you're not able to activate your glutes as much. We see that with chronic lower back pain too. Standing would kind of be the opposite. You've got more upright weight bearing through the joints, especially some of the feet. If you don't have proper shoe wear, that can be a huge impact. Most of us tend to stand on one leg, like shift towards one side if we're standing for long periods of times. So females especially will be predisposed to some of like the sacral iliac ligament issues, kind of tissue creep, as we call it, like ligaments stretching a little bit more, and then you're creating an asymmetry. I
What
mean,
is
the
that?
best. What's
What
that?
does that? What does that end up as? Like, in layman's terms, like what happens in those cases? For example, the gluteal insufficiency or the hip flexors shortening. Like, ultimately, that person, what are they feeling or experiencing, or what are they predisposed to?
Yeah, good question. So let's take all of these will create different things. So that's why when I'm working with a patient, I really want to try to understand what their daily activities and movements and positions look like, so I can get some more clues into what they need and what they don't need. So gluteal insufficiency, for example, your inability or reduced ability to contract the gluteus muscle fiber or motor units, right? Actually turn them on, turn them off, create that muscle tension. It's the biggest muscle group and we have in our body by volume at least. And if it's basically a hip extender, essentially, right? So if you're not able to use the glutes, if you're like squatting or bending over or going upstairs, for example, the next muscle group up that you have to use are the lower back muscles, right? They're not really designed for heavy loading or lifting. They can be very strong, but why use those when you can use the glutes, right? So, or another thing, if you're generally more towards postmenopausal females with a lot of sitting, the gluteal tendinopathy. So basically, like the tendons are on stretch a little bit. The fibers become disorganized, and then you get pain at higher risk of tearing, and can create a lot of discomfort.
Pain where? Lower back pain or gluteal
Lower
pain?
back, hip pain.
Hip pain. Okay.
Yeah. Um, So that's a quick overview of like why the glutes are important, why you wouldn't want them turned off or the volume knob turned down. What were some of the other ones examples I gave?
You mentioned hip flexors shortening.
Oh,
You
sure. Okay.
mentioned
Yeah.
your spine. Yeah.
Hip flexors being shortened. They're a major muscle group. I always like to show patients the cross section of their MRI so they can see just how thick and massive the psoas muscles are. Because people, a lot of the times, they're an afterthought. And the psoas specifically, when we say hip flexor, we are talking about the iliopsoas. So the iliacus and the psoas, which are two different muscles, both start at the upper inside of the femur, and then the psoas attaches to the front kind of outside of your lumbar spine, the transverse processes. So if you imagine a tight psoas, it's basically pulling you into anterior pelvic tilt. It's pulling your lower spine forwards. So you're kind of in a more extended position, right? And that can kind of throw off some of the posture, some of the motor patterns, some of the leveraging, all of that kind of stuff. We could go down a rabbit hole with hip flexors, but that can create a whole slew of
practically
problems.
speaking, so basically sitting for long periods, you're saying, is ultimately going to result in inefficient movement, or for example, in the case of the
compensatory movements. Yeah.
Okay.
Yeah.
And which can result there down the line in pain, chronic pain, let's say low back or hip pain. Okay. So there's a definite impact there. I would say that's probably quite common. Actually, I probably myself suffer a little bit from that as far as the hip flex. Can it make the hip flexors weak?
Yep.
Yeah. Okay.
Yeah.
So yeah, definitely suffer from that.
A shortened muscle is quite often a weak muscle.
Okay.
Yeah.
All right. Let's talk a little bit about other impacts here. So in an unhealthy workspace, if stress is high, we did an episode on chronic stress, right? I think I joined at the end of that one, but we know that that's going to impact blood sugar. That's going to impact our immune system, not in a good way. It's going to lower your ability to fight off infections. Your blood sugar is going to be raised. It can increase your blood pressure. So there are real impacts from chronic stress. There are real impacts from poor eating in your workplace. So if you don't have access to healthy food, healthy snacks, if you're not hydrating correctly, and you spoke about the spine in a previous episode where hydration is a big part of it, it's a large part of that is water. And so if we're not getting enough, I would imagine we're probably also impacting spine health to some degree. And the lack of access to healthy food, healthy nutrition just predisposes us to first and foremost eating more highly processed foods, which increases the risk of chronic diseases like type 2 diabetes, overweight, obesity, high cholesterol, etc. And we can go into those in detail on another episode.
Whatever, dude. We know work is stressful. Tell me things I can do to make it not stressful. Is that even like if you're consulting with a patient and they're saying their work environment is just crazy stress, just sympathetic overdrive, what are you saying to them? Or how are you even going down that diagnostic criteria?
I don't know if I'll call it diagnostic criteria, but that's a good question, because I would approach it maybe slightly. Well, I definitely would approach it differently for every person. So the first questions I'm asking is to figure out what's the source of the stress, right? Like, is the high stress the work itself? Is it like a really high responsibility job? Are you in a high sort of more of like a leader position that's stress in that way? Or is it high stress because your boss is abusive, or their leadership is very much fear-based? Is it high stress because you are understaffed and you basically have no time for anything? There's so many reasons why someone could be stressed.
So you're trying to identify. Tell me if I'm understanding
what's the source? Yeah.
If it's like external or internal, and then if it's external or internal, like what are the primary causes, and then you go to try to treat that.
Yeah, I mean, I like that you said external, internal. I didn't even think about it like that. But yes, essentially, I'm trying to figure out, in a nutshell, what's the source of that stress? And is it something that we can impact, right? Because, for example, if the source of stress is a poor leader in that workspace, there's not a whole lot one person can do necessarily, it's not that they can't do anything, but
Well, don't tell Pega
uh,
that.
right.
Pega's gonna hear this and be like,
Yeah,
these
there, yeah,
assholes.
yeah. No, you can't.
There's
You
so many
can.
things I can do work with a
Yeah,
patient on.
you can reframe things, obviously, but I mean, um, in those cases, you'd probably get HR involved, and that again, I don't want to go down a rabbit hole on one very specific scenario, but I'm trying to assess what's the source of this stress. Let's let's speak generally here. Um, Kind of physical stress response in between, um, I guess, depending on the type of work you do, right? So I'm going to say in between patients. That's why I always say in between. But let's say during your breaks, right? So that will be in between time and whatever task you're doing at work. Doing things like breathing exercises that are known to reduce your stress levels, something I recommend. Movement, so kind of more in your world here. Um, I recommend if you can just get out of the workspace, go outside, get some sunlight exposure, get some steps in. If you can't, maybe take the staircase up and down a couple of times. Movement, we know exercise and movement does help with stress, does help with mood. So those are things I would incorporate. Doing.
Well,
Go
let me
ahead.
jump in here if you don't mind, because
Yeah, I don't.
I think this is relevant. I was speaking to a lovely lady yesterday actually who just recently left corporate America, and
Okay.
she's looking to start kind of a wellness type of business. And we were talking about corporate wellness strategies and all the offerings there. And she, in her experience, it was, yeah, there's a lot of good potential offerings that the job might bring in, you know, a yoga class or a guided breathing workshop. But the sense was nobody really wanted to do that because they were all fearful and afraid of leadership having this perception that they, you know, they weren't involved in hustle culture, or
Uh
like
huh.
it reflected poorly on them that they needed this extra wellness to be effective. And I do think that that is a thing. So we have all these strategies and these concepts and these tools that are very, very effective, but what would you say to people that just are unwilling to implement them because they're fearful of those responses?
Well, you bring up a really, really important point. And you called it hustle culture, but generally our work culture is like that, right? We do tend to champion people that quote unquote hustle. Oh, you were up all night working on that project, like you're a champion, you're a winner. Oh, you took breaks, like boo hoo, poor you type of thing. So there is a real problem with our work culture when it comes to that. Um, and you're right, just having those resources for those things, let's say the yoga class or all these different wellness modalities, it's not enough. It's important that work culture prioritizes and encourages the use of those things, right? And I think really in those scenarios, leading by example is one way. Now, I'm a microscopic version of that here at my practice, right? But because I now own my own practice, I get to dictate to some extent the work culture. And it's a shame Pega's not here because she could kind of vouch for some of what I'm about to say. So as you know, she shares office space with me twice a week, and I have a pretty, I want to say a strict rule, but I highly, highly encourage not eating where you're working. So I don't eat in this room. I have a separate space, and we've got a dining table on purpose because I wanted to create a work culture that encourages taking an actual break and focusing on what you're eating, maybe having some conversations outside of what your work entails, just for mental, physical health, right? So I think it does come from the top down. It should come from the top down where it's encouraged. Maybe if the employees see their, the next sort of the next tier above them using these services and the ones above them, it hopefully would change the culture. But I don't know if that's practical for anyone listening necessarily, because yeah, if you work for an amazing company that values these things, phenomenal, right? But a lot of us didn't or don't, and so don't have those options. So what do you do in that scenario, right? Maybe you don't even have those resources in place, and if you did, I would say use them. I would say check the rules and say, hey, you guys have that yoga class, you have this, you have that. Like, what is the expectation here, right? Like, get a clear understanding of what's the expectation from your bosses or from, all these folks at work in terms of how you're using that. and then use it. I mean, if it's there for it, right? That's what it's there for. What were you? I mean, what do you think about the example you gave for that wellness initiative?
What do you mean with the
Like, how would
issue
you?
of perception?
Yeah, and the hustle culture and having the resources, but not necessarily, being afraid to use the resources.
Yeah, I don't know. I think that's a systemic culture thing. Maybe not specifically to America, but definitely heightened in our country for a number of reasons. But I don't know. I mean, I felt the same way when I was a younger therapist. I was always hesitant to take my PTO. It's like PTO that I had, but I'd be like, oh, I don't want them to think I'm backing out of days or something like that. And it's just weird. I don't really know where that comes from. I'd love
That
to.
comes from your training, from your peers, from just the
Yeah.
culture again. So I would say, practically speaking, you're bringing up a lot of good points. So let's focus on like what somebody could actually change, right? So let's just assume you're in an average type of company where it's not particularly abusive, but you don't have all these luxurious wellness facilities at your disposal. What could you do? I would say you brought something up really important, is one, use your PTO. I mean, don't, you know, obviously I know people like to accumulate them in the scenarios where they can and take a longer trip. I don't know. Everybody can decide for themselves, of course, but I would say I would encourage more frequent breaks as opposed to sort of burning yourself out over months just to take like a 2 week, vacation. Um, and looking at your workplace and looking at what options are available to you. For example, like I said, exposure to daylight, getting out, getting some movement, maybe building some good friendships, some camaraderie around you in that workspace. If you have a good support system there, leaning on it a little bit, right? That makes a big difference. Um, I would say really common is poor nutrition at the workspace, right? Either skipping meals or just eating crap, basically, right? Because you didn't really plan for it. So I would say become the architect of the environment that's going to be conducive to better health, right? We can obviously do that a better job with that at home because we're more in control of that environment. But at work, that means prepping and bringing healthy snacks, bringing your own lunch. Is it a bit more work? Sure, but I think ultimately it guarantees that you're covering for your nutritional needs. Bringing your water bottle, putting it. I like to suggest putting it within line of sight so that that can just be a trigger for you to go ahead and take a sip. I'm really bad at that, by the way. So I say that, and I still struggle to do it myself. Um, like I said, breathing exercises. I actually do that from time to time. I'll do a bit of deep breathing during breaks. I have resistance bands here in the office, as I probably have said multiple times before. I use those just to kind of get a quick movement going on, a little bit of resistance training in between. It helps me. And then guided meditation. I use an app on my phone. Like I'll do a 5-minute thing. I'll just sit back in a chair, or maybe go to the balcony. I have the luxury of a balcony. If you don't, get outside, sit on a park bench, whatever it is, do a bit of guided meditation. But find the thing that for you helps calm you down, puts you in like that really positive mindset. And that could be listening to a podcast, haha, hint, hint, or that could be, like I said, a guided meditation. Thank you for the nod of approval for my dad style jokes. Um, but you got to find that thing that works for you, because again, what I do might not be as effective. Is there anything that you do, Adam, during your workday that's sort of part of you taking care of yourself and your health?
Yeah. Well, I work in a gym, so whenever I have an
That's a good
hour in
perk.
between patients, I work out, which is pretty helpful. But I work by myself in a gym, so I don't know how realistic that would be for most people. But I keep coming back to just the systems and cultures at play. If you look at even some of the Asian cultures, like they'll have like a group led like stretch and exercise session. Well, you'll see the business of men and women in suits doing like the toe touches and jumping jacks. Maybe not jumping jacks, but why don't we do that? Like it's clear, the data is clear that it enhances productivity and
Yep.
culture. It's like, why can we not, for the first 5 minutes of a meeting, do like a quick guided stretch or a quick guided breathing exercise? I don't
I
know.
think
It drives me crazy.
I think that you and I assume that that knowledge is widespread, that it does increase productivity, but I don't. I think part of it is that it's not necessarily, especially with uh, obviously you look at big companies. Some of them really get it, right? Some of them really understand it, and they put a lot of money and resources into making sure their employees
Like
have
who?
access to this thing.
Give
Like
me an
Delta,
example.
Delta, Delta's really takes
That's
good.
fair.
Shout out Delta, give me some free flights, please. Um, they they take really good care of their employees because I have some friends that are Delta employees, and they tell me about. I mean, they essentially have access to multiple gym memberships. They have access to so much psychological help. They have access to so many resources that are beneficial for the health. So taking good care of your employees will indeed yield more productive employees that are less jaded, that are more loyal to the company, that are going to do better work. And
Yeah.
I just think it's a win-win, right? I
Especially
don't.
with the stupidity that is our healthcare being tied to our jobs and the employers
Yes.
paying these premiums. Why? I just don't understand why it's not more of a factor in decision making
Yeah.
or
So
improving wellness.
if you're a company owner or a business owner, or you're in a position where you can make decisions, look into it. Look at the data. Like Adam said, the data is really clear. You keep people healthy, they're more productive. You keep people happy, they're more productive. You do better as a company. It's a better work culture. I don't think there's a one solution to this. I think it is, as we're talking, it's a cultural thing, and it's a slow shift. um, I know with these newer generations, they are a lot more savvy when it comes to wellness, and I'm a lot more aware of that. I don't know if maybe the pendulum has swung a little too far in that direction, where anecdotally, like I'll hear folks that don't want to be in the workspace at all, and they want to do very little amount of work. I don't know. I don't have any actual data on that, so don't quote me. But I would say somewhere in the middle there, um, there's probably a healthy medium to be found. At least that's my opinion. I would say, again, the way I approach this, just today, I was actually giving some work advice to my sibling, um, and it had to do with what's fair, right, and being taken advantage of. And so then the type of work that was being done was affected by that. And my recommendation was, hey, you got to work in a way that's aligned with your work ethic, right? And kind of sometimes it's not helpful to think about what's fair and what's not. And I understand a lot of times it's not fair, but you just have to do right by your own values, and then down the road adjust where you have to. That might mean looking for another job. But I think if we're saying, well, these guys don't care about me, so I'm just going to punch in and punch out and do the bare minimum, you're taking the joy out of your own work, is what I'm
Yeah.
saying.
Fair is a
um,
weird one though, because people don't, especially employees, don't have all the facts of what's going on. It's like, oh man, they're making all this money and they're paying me, 30 cents on the dollar of what I do revenue wise and these benefits and those benefits. But it's like, well, do you know what it means to have employees and pay healthcare premiums? And I'm certainly not taking the side of employers here, but if both sides understood the full picture a little bit better, maybe they could have a better relationship, even if that's just being more transparent with, like, the financials of a business and the where the markets are moving.
I think that's tricky. I think you bring up a good point. I do think that better communication, so being more inclusive of sort of employees in the workspace, as opposed to, well, that's above your pay grade type of thing. I think just it for me, it comes down to someone understanding that their work is meaningful and useful, right? We need that sense of purpose. So when you go in and it's like it's so disconnected from the higher tiers or levels in your workspace, you can feel that way, like, is what I'm doing really even important? Like, I'm so replaceable here, right? They don't even know my name, or whatever the case is. So I think better communication there, and not this sort of canned email saying the typical stuff. I mean actual, you know person to person, like your superior coming in, or having an actually useful meeting, right? Where they're discussing, look, this is the end goal. This is why you're doing this. I don't know. It's tricky. I don't own a large company, so I don't pretend to have the solutions to that, but I do agree that there is a big disconnect. And so the employer is usually viewed as like this billionaire that's evil, and the employee is sometimes viewed as lazy. They don't want to work, and I think that's just lack of communication. I think if expectations were clearer, communication was better. That would probably improve. But I wish I had a solution to that. I don't. I work in my very tiny microscopic company here, so it's not a part of my day to day. But I do see it in my patients and in my past, at least.
Universal basic income. That's a no, we're not going to go there. Okay,
I'm not going
Moving
there.
on.
Yeah, I'm not going
Moving
there.
on.
All right, so let's wrap it up. I think, practically speaking, if someone just tuned in right now, what would be like for you top 3 high yield things somebody could do in their workplace to immediately improve their situation health wise?
I would say number 1, try to understand what your tissue stresses are going under and then work backwards from there. Like if you're sitting, okay, you know that your hip flexors are shortened, stretch those hip flexors. Or if you're standing, shoe wear is super important, right? Ideally having 2 different pairs of shoes that you alternate, so like the insoles can recoil in that day. Or does that make sense? Like the ones that you're not wearing, the insoles can recoil. So 2 pairs of shoes. I made some notes on the standing one.
So you're saying to like alternate shoes between
day to day, like Monday wear one pair, Tuesday wear the other pair.
Yeah, gotcha. So that it can start like expand and not stay compressed. Also, probably from a moisture standpoint, that's probably a good idea too.
From
right?
a moisture standpoint, yeah, compression socks to help with blood flow if you're standing long periods, even sitting. I mean, I'm a big advocate for the old compression socks and stockings. Just stretching more. That would be the big thing. But it's so, I could talk for hours on specific interventions. So just call me, Dr. Adam Holsworth, Equalizer. It's like, just try to get a sense of, okay, reflecting on what you're doing, right? Okay, I'm sitting for 6 hours and then I'm standing for 1 hour giving a presentation, and just get a sense of what's going on, right? Your glutes are probably in a stretched and dialed down position with the sitting. Your hip flexors are tight. Okay, do some things that challenge those. Stretch the hip flexors, do a glute exercise. And we talked about some of the standing things that I dealt with and deal with. But trying to get movement and trying to make sure you're having good blood flow, right? So increasing the heart rate to get improved systemic blood flow, or moving specific areas that you might be feeling tension in, right? Doing some neck stretches or some shoulder rolls. But I generally, when I'm asked questions like that, I'm hesitant to give specific advice because it always depends on the person, and I'm more interested in giving people general advice that, well, they can see how I think, so that they can solve the problem themselves. You know what I mean?
Okay. Yeah, that makes sense.
Yeah.
I would say, generally speaking, if I were to answer that question, I think the nutrition piece is huge. So if you have the capacity, patience to pack your own food and snacks, that's probably going to be the best option. Second best would be to identify around you what are healthier options as far as meals go, and sort of have a game plan going, right? So again, going back to that, becoming the architect of that environment, which you want to make into an environment that's conducive to better health. I would say setting boundaries at work is a very important one, and also very difficult. For me, at least personally, it always was. That means knowing how to say no and when to say no, so that you're not always on, right? So there's a distinct sort of cutoff, like, all right, after this point, I'm not on anymore. I mean, maybe set up an email response saying, hey, I'll be back in the office in the morning, whatever that is, right? Setting those boundaries is important. The hydration piece is important. If you can take any meetings or calls standing or pacing or walking, that's what I do. I pace around this office anytime it's not a face-to-face thing. But I probably should start thinking about a standing desk. Like I could be doing this, right? We're spending whatever, 40 minutes, an hour here. I could be doing this standing. It probably would improve things so that I'm not sitting all the time. I would say taking frequent breaks. They don't have to be long breaks. These can be, 5-minute things, 5 minutes where you just do some nice, deep, slow breaths, 5 minutes where you listen to a song that really makes you feel good, 5 minutes where you go and stretch like you were suggesting, 5 minutes where you go stand outside and enjoy the beautiful day, look at the trees, the whatever it is that makes you feel good. 5 minutes that you go up the stairs and down the stairs a little bit, some movement. So it's your workplace is not going to change overnight. That's a reality. I mean, it could if you change jobs, but more likely it's not. And that doesn't mean that you can't change things around it to improve your health and to prioritize yourself. So that would be my takeaway from all of that. I don't know. Thoughts? Anything to add? Takeaway?
No, I wasn't listening to a word you said. Could you repeat
Fantastic.
yourself, please?
Yeah, no, again, I don't even remember what I said.
No, it's all good. I think the big thing is trying to better identify the areas that you can improve upon and then making a plan to sneak things in there, just inch by inch.
I like that. There is something we haven't touched on that I think is relevant. This guy, the cell phone. So a lot of times folks on their breaks, you just catch people scrolling on social media on here. That's not a real break. I would just say, make sure, you leave the phone, you actually get off of it, get off a screen, get off a device, get out and actually move your body. And anyway, that's my 2 cents, because that's probably not helping either, right? Because you're looking at all these cool images of people outside doing fun stuff and you're stuck inside doing work, and it's not helping your mental health. I think Becca would agree with that. She's very anti-social media. Anyhow, if you have nothing else to add, I think that's all I got to say about that.
Nope, I'm all tapped out.
Yeah, it sounds like I think we have that sort of end of day energy. We might have to change what time we record these.
You have
things.
emptied me, sir.
Yeah. I've been leaving alone all of the double entendres today. I'm very proud of myself.
You're not biting on anything.
No, I'm not even that. All right. With that said, we'll catch you guys next time.
Awesome. Thanks, brother.
Take care, man. Thanks for spending some time with us today on Take 3 and Call Me in the Morning. We hope today's conversation gave you something to think about. If you enjoyed the episode, consider subscribing, leaving a review, or just sharing it with someone who you think would appreciate it. If you want to learn more about us and our individual practices, you can check out Pega's practice on her website, livingfullytherapy.com. If you're interested in Adam's physical therapy practice, you can learn more about his practice on his website, equalizerhealth.com. And if you want to know more about my practice, you can go ahead and check us out at healthyconditions.com. Just a quick reminder before we go, remember this podcast is for informational purposes only, not intended as medical advice. So please talk to your healthcare provider about what's right for you. Until next time, and don't forget, be kind to yourself.